Welcome to the DNA Lounge. Today we have a special genetic disorder case. This disorder's scientific name is fibrodysplasia ossificans progressiva, commonly known as Stillman syndrome. I'm your host, Madison Yip, and I'm here with special guests, medical professionals Jada, Anastasia, and Sam. Hi guys, thanks for coming on the show to talk to us about this mysterious disorder. Please introduce yourselves.
Hi, my name is Jada Williams, and I am the top researcher at Johns Hopkins University, and I specialize in genetic disorders. I'm so happy to be here today to talk to you guys about Stillman syndrome.
Hi, I'm Anastasia Gonzalez, and I am a geneticist working for CDC. Thank you for having me on the show.
Serious, stop it. Stop it,
My
Sue.
name is Sam James. I'm a world-renowned doctor who specializes in patients with genetic disorders. I'm so happy to talk to you guys today.
Thank you all for coming. So, how did this disorder become known as Stillman syndrome?
Well, scientifically, we call this disorder fibrodysplasia ossificans progressiva, but it became known as Stillman syndrome after its symptoms of hard, stony swellings on the skeletal and connective tissue. This results in significant morbidity and disability, and is because of the ossification of the bone.
Can you elaborate on what ossification does to the body?
Of course. Ossification is the process of bone formation. So, in this case, it causes muscle and soft tissue to become bony structures, as seen in these pictures.
Alright, let's take a quick break and we'll be back in a bit. Alright, welcome back. Getting back to FOP, what are some of the symptoms of the disease?
The common symptoms are ossification of the muscles, joint fusion, and progressive restriction of movement. The most common cause of death for those with this disorder is cardiac and respiratory failure due to the aforementioned symptoms.
Now, from what I understand, this is a rare event, but how often does it occur?
Approximately 1 to 2 million people can get this disease. Females have a 54% chance of having it, while males have a 46% chance of getting it.
Wow. What is the life expectancy of an FOP patient?
The estimated life expectancy is about 56 years. Death often results from thoracic insufficiency due to ossification of the patient's thoracic cage.
Is there one particular population that the disorder affects more than others?
The disorder does not affect a certain population, gender, or race over the other.
What type of disorder is FOP, genetic or chromosomal? Furthermore, can you elaborate on what those are?
Of course. Stillman syndrome is an autosomal dominant transmission or sporadic gene disorder. A genetic disorder is when a single gene is mutated in the same way, whereas a chromosomal disorder is when a chromosome is missing or even added.
What are the names and numbers of the genes affected?
There is a heterozygous missense mutation in the activin receptor A type 1 or ACVR1 and a bone morphogenetic protein BMP type 1 receptors. Most cases of FOP are sporadic, but inheritance can occur. The mutation causes the loss of autoinhibition of ACVR1 and render it susceptible to dysregulation signals through the BMP pathway.
Is this disorder recessive, dominant, a spontaneous mutation, or a chromosomal abnormality?
As stated before, most cases are sporadic, but also can be inheritable dominant.
Okay, we're gonna take another break. See you soon. Alright, back to the main topic. Are there different forms of the disorder or varying degrees?
No, there aren't any different forms of this disorder.
What are the treatments for it?
Unfortunately, there are no good treatments or cures for FOP. Surgery usually won't help either because, with the removal of the excess bones, more bones continue to grow and form. However, there are treatments such as high doses of corticosteroids. This can reduce the symptoms of the condition but will not cure the disorder.
In what direction is the research in this field headed, and what do scientists hope to do in the future regarding FOP?
Researchers are still searching for a cure and want surgeons to avoid unnecessary procedures and excisions of heterotopic ossifications. Surgeons have to wait until the heterotopic ossifications are fully formed, and then surgery is highly indicated.
What would it be like to live with this disorder, and what are the obligations of a caregiver of a person with the disorder?
Many affected people are unable to move as their muscles become bone. Some are lucky enough to be able to eat, speak, or even write. There are flare-ups that make nearly doing anything impossible, and full-time assistants are required, which usually charge hourly and around $20 per hour.
Are there any famous people with this disorder or researchers who have worked on it?
There are no well-known individuals in both cases, but we're hoping with this publication we will get more researchers willing to fight against FOP.
Wow, thank you guys so much for coming on the show and spreading awareness for this disorder. I know our viewers at home appreciate it. Well, that's all we have for today, folks, and thank you for joining us today.